Hello, this is Dr. Grande. Today's question is, what is a highly sensitive person? If you find today's video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. So back to this question of the highly sensitive person. This construct was developed by Dr. Aron in the 90s. And there's a few terms that are all wrapped together, and this gets a little bit confusing, which isn't uncommon for relatively new constructs in the world of personality theory. So when we look at the highly sensitive person, that's an individual who has sensory processing sensitivity. Or we could look at it this way: they have the highly sensitive trait. So this is not a mental health disorder, but rather a trait which would be largely considered based in genetics. So it would be heritable much of the time, although the environment could play a part in developing this trait as well. So what do we know about the highly sensitive person construct? Well, it's associated with a number of characteristics, including an individual who's more reactive to stimuli, so they tend to get overstimulated by lights, noise, being in crowds. They tend to process a lot of sensory information, so they can detect subtle details, and they're alert, but this can become overwhelming, and they need to recharge. And sometimes we think of this as needing more sleep on some occasions. Now, some of these traits seem to be analogous to what we see in the 5-factor model. They are, and I'll talk about that in a moment. This trait is associated with a higher level of conscientiousness, more creativity and imagination, and a decrease in the level of extraversion. So an individual with this trait would be introverted in most instances. Now we know too that the highly sensitive person tends to process emotions more deeply, and the word we'd use here would be insight, and they tend to have more empathy, so they have a better ability to understand the feelings of other people, and they have more emotional reactivity. So the reaction to stimuli and to emotional processing would more likely involve something like crying, laughing, or feeling distressed. So far, the research indicates that about 15 to 20% of the population could be classified as highly sensitive, so a fairly large proportion. And we know that the construct may not be simple. A few studies have indicated there might be 3 subtypes of the highly sensitive person: the aesthetic sensitivity type, the low sensory threshold type, and the ease of excitation type. And all of these different types have slightly different characteristics than the other types. So a question I get a lot about the highly sensitive person construct is it real? Is this a real thing? It's relatively new, as I mentioned, in personality theory. Well, there have been a number of studies that indicate that this construct appears to be legitimate, including studies that look at brain functioning and structure. As with any construct, more research would be better, but so far I do tend to think that this is a real construct. Its exact characteristics, I think, are still unknown because we do need more research. But in general, in looking at the research, I'm convinced that the highly sensitive person construct overall is legitimate, and it does tend to explain a lot of what we see in personality theory. Another similar question, which is probably just as important, is this construct useful? And this is probably even really a more important question than is it real at this point. Is it useful? What can we do with the construct of the highly sensitive person? Well, this is not a mental health disorder, as I mentioned. It's a trait, so it's not something that can be treated, and really not something that can be changed all that much, particularly the overreaction to stimuli. That tends to be hardwired. It's neurological rather than psychological. So if this trait is relatively stable and it's not a mental health disorder, why do we need to know anything about it? Well, there are a few reasons why I think it's important. One is, if an individual has a mental health disorder and they are a highly sensitive person, knowing that they're a highly sensitive person and knowing what those characteristics are could help inform treatment. It's something that a mental health clinician should know when treating an individual who is a highly sensitive person, and it can be helpful in developing a treatment plan and really understanding that person. Another reason I think this construct is important is even if an individual is a highly sensitive person and there's no mental health pathology, so there's no mental health disorders present, It's just generally important, I think, to understand your own personality. We see a lot of this in the research of the 5-factor model. Individuals find it useful to know if they're open to experience, conscientious, extroverted, agreeable, or if they have high levels of neuroticism. It tells us a lot about how we form relationships, how we make decisions, what careers we choose. So understanding your personality, in general, I think, is helpful to getting the most out of life. Now, of course, as far as the highly sensitive person construct goes, there are a number of skeptics, there are a number of scientists who are not convinced that this is a real construct or that it's useful. And I think we need to wait and look at the research to make that determination. But in the meantime, as I mentioned, I like this construct. A lot of people connect with it. I think it tends to be helpful to understand the characteristics of the highly sensitive person, and I'm really interested in reading more research as it becomes available. I hope you found this description of the highly sensitive person to be interesting. Thanks for watching.